Today we will speak about bone density testing. So let's start. Definition: it's measurement of how much minerals like calcium in your bones. The most common bone density testing is Dexa scan. It's used for diagnosis of osteoporosis, detection of fracture risk, and monitor the effectiveness of osteoporosis treatment. Dexa scan can be used to evaluate bone health in ways beyond the measurement of bone density, like vertebral fracture assessment, trabecular bone score, full length femur imaging, and hip structural analysis. The test takes a few minutes. You don't need to undress, but you must not have buttons or zippers in the area of the spine and the hip. It's not invasive and not painful. There is no needles will be inserted in your skin. There is very little radiation. The technician will ask you to lie on DEXA table where a scan arm will move over your body and scan your bone. Diagnosis of osteoporosis. The output of DEXA test is a number called T-score. Normal T-score is zero. The more negative the number, the weaker the bone, and more liability to break. If T-score is minus 2.5 or below, diagnosis of osteoporosis is confirmed. Second is fracture in old patient more than 50 years old. Fracture spine, hip, wrist, humerus, rib, or pelvis. They have probability of osteoporosis. Fracture of spine and hip in old patient, regardless of their T-score, meaning osteoporosis. Fracture risk calculator. If the 10-year probability of major osteoporotic fracture, meaning fracture spine, hip, shoulder, or forearm, is 20% or more, or if the 10-year probability of hip fracture 3% or more, then diagnosis of osteoporosis can be made. Indication of bone density test. First, female 65 years or old, female between 50 and 64 years with risk factor, male 70 years or old, male between 50 and 69 with risk factor, anyone who has broken bone after age of 50. Risk factors for osteoporosis or fracture include family history of osteoporosis or family history of frequent fracture, frequent falling, vitamin D deficiency, smoking, excess alcohol intake, malabsorption, and some medicine like prednisone. When to repeat DEXA scan 1 to 2 years after starting or changing osteoporosis medication to evaluate response to treatment. And also if 1 to 2 years if you are not treated but you are close to treatment threshold. Understanding DEXA results. T-score of -1 or above is normal bone density. T-score between -1 and -2.5 meaning low bone mass or osteopenia. T-score of -2.5 or below meaning diagnosis of osteoporosis.